Monitoring must be taken into particular consideration once treatment is implemented. Does this treatment mean that the eye is no longer growing or not growing as much as it was prior to treatment? Is this treatment effective? As such, we are going to control eye growth in terms of the axial length. And this is particularly relevant when we perform orthokeratology or use atropine. When we perform orthokeratology, it is very difficult to obtain a prescription for the child as the diopters, the prescription, are hidden by the orthokeratological effect. It is not acceptable and would not be desirable clinical practice to make the child halt orthokeratological treatment every 6 months to see whether the myopia is still increasing or has stopped increasing. We do, however, have clinical strategies, including obtaining the prescription for the contact lens, although they remain approximations, as this is not a direct measurement. When atropine is applied, higher or lower concentrations of atropine will affect the accommodation to a greater or lesser extent, and this obviously can affect the refractive state. As such, in these two specific cases, it is of great help to be able to perform biometry at each time point. In the case of orthokeratology, it would be of interest to perform a baseline biometry for comparison at each visit once treatment is complete. After a month or month and a half, once we consider that the contact lens has done all it was intended to do to the cornea, we perform biometry and label this as baseline, and we can then compare this with the periodic progress of the eye. How can we do all that? Well, I'm going to introduce you to Topcon's Maya multi-platform. Maya is a topographer, as we can see on the screen, with a broad cone. It is a biometer and can also be used to analyze the corneal surface, with a particular emphasis on dry eye.